Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll-free at 1-800-522-0071, and you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we can't see or hear you. If you have any questions, please type that in the chat. At the bottom of your screen, you will see several options, one of those being chat. And if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director of the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance. Ray, excuse me, Ray has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Good morning. Thank you, Rachel. Hope everybody had a great Thanksgiving. I enjoyed mine tremendously. I got to spend a lot of time with family and grandchildren, and everybody got my Christmas decorations up, and I have the soreness to prove it. And but we're ready to move into 2025. Hopefully, everybody has gotten their plans made. If you haven't, well, first off, let me do our little commercial. Our program, the Medicare Assistance Program, is funded by several grants from the Administration for Community Living, which give us funds to go out and educate people about what Medicare is and how Medicare works, and what are the different options available when a person is on Medicare. Also gives us money to go out and educate people on how they can protect themselves against Medicare fraud. As well as programs that can assist people who are having challenges affording their prescription medications or just the costs associated with Medicare in ways that they can afford those programs. So now, last commercial of the year, Medicare open enrollment ends December 7th, which is next Saturday. So if you haven't made those decisions, if you haven't decided what you're going to do in terms of a Medicare Advantage plan or a Part D prescription drug plan, or if you've got questions about your retiree plan or anything, this is the week, folks. Give us a call, 1-800-763-2828, and speak to a counselor. Get that figured out. Don't miss the opportunity to possibly save a considerable amount of money by making sure you're on the right plan for the medications that you're taking. So, all right, I'll shut up about that. Our focus today is on the changes that are taking place for 2025. So, what we're going to start with are the basics, the things that change every year, unfortunately. And let's start with the costs. First off, the Medicare Part A premium. As we all know, most people get their Part A premium free. That's because they have been working for at least 10 years, paying FICA taxes. Now, if someone has not been paying FICA taxes for 10 years, they can still get Part A, but they have to pay for it. So if you've worked at least 30 quarters, you can get Medicare Part A, which most of us associate with being the part of Medicare that pays for inpatient care. You can get that for $285 a month if you've worked at least 30 quarters. Now, if you've worked less than 30 quarters, you have to pay the full monthly premium for Part A, which this year will be $518 a month. So it's important, if you don't know, find out. The best way to find out is to contact Social Security. Also, you can draw on your spouse. So, just as we've always done, is if you haven't worked enough quarters, but your spouse has. As always, you can always draw on your spouse's Social Security contributions to enroll in Medicare Part A. The deductibles, unfortunately, have continued to go up. The inpatient hospital deductible per benefit period has gone up to $101,676, which that's about a $44 increase over last year. Then once you've met that deductible covers you for the first 60 days of hospitalization in that first benefit period. Then after that, you would pay $419 a day for days 61 through 90. And then starting day 91, that goes up to $838 a day. So those costs have risen a little bit. Skilled nursing facility care also went up. That is still covered at 100% for days 0 through 20, but starting day 21 through 100, it's gone up to $209.50. Part B also went up a little bit. The monthly premium has gone up to $185 a month, and the Part B annual deductible has gone up to $257 a month. Now, and then after you've met that deductible, Part B covers, as usual, about 20% of your healthcare costs for services that are covered by Medicare Part B. Now, there is a new option with Part B for those people who have had a kidney disease, they've had a kidney transplant, and they are 36 months post kidney transplant, successful kidney transplant. With ESRD Medicare, one of the caveats is once you have had a kidney transplant, after 36 months, you no longer qualify for ESRD Medicare. But those people still need those immunosuppressive drugs to maintain that healthy kidney. So they've now created this Part B immunosuppressive Part B benefit. So those people can enroll in this program and they pay $110.40 a month, and that will cover those immunosuppressive drugs that they need to maintain that healthy kidney after that transplant. Now, we also still have the income-related Medicare adjusted amount, or IRMA. That's for those individuals in higher income brackets that are required to pay more for their Medicare Part B. I didn't, in the interest of time, include the information about the IRMA costs and stuff because that gets into a lot of information, and I've got other things that I feel are probably more important to this audience. But I did want to include the link on here. So if you've got your phone and you want to take a picture of that, if you want to look at that, or you can just Google IRMA, trust me, it'll pull up the tables for you. You can see what those income tables look like for 2025. The big change that's coming for 2025, the Inflation Reduction Act had a lot of changes in it. And over the course of the past few years, we've seen things like a $35 cap that was put on the insulin costs. And we saw where they raised the limit for people to get full extra help to 150% of the federal poverty limit. So there's been some nice changes like that. Well, this year, the big change that's taking place is they put a $2,000 cap on the out-of-pocket costs for all Medicare beneficiaries who are enrolled in a Part D drug plan or a Medicare Advantage plan that includes prescription drug coverage. So the beneficiaries would continue paying their monthly Part D premium or their Medicare Advantage plan premium, if there is one, each month for their plan. But once the cost from their deductible as well as their copay or coinsurance reaches that $2,000 mark, they don't pay anything for the rest of the year. So for those people who have very high drug costs each year, this is really going to be a lifesaver for those individuals. We see so many people who are taking some very, very, very expensive medications, and this is really going to make a huge difference in those people's lives. So now keep in mind, this does not include the monthly premiums. The monthly premiums, they would continue paying those regardless. But it does include the copays and the coinsurance as well as the deductible. that information, that's what gets fed into figuring this $2,000 amount. But it is still very important for people to continue reviewing their Part D drug plan on an annual basis. The reason being is for it to be figured in with this $2,000 cap, that medication does have to be on the drug list for your Part D prescription drug plan. So it's still going to be very important for all beneficiaries to continue reviewing their Part D coverage every year to make sure that they've got the best plan available for themselves. The other thing to keep in mind of why that's important is because there could be a plan out there, now that there's this $2,000 cap, there could be one plan out there that's got a monthly premium of, say, $15, and another plan out there that's got a monthly premium of $70. Both may cover your medications, but since we've got this $2,000 cap now, if you can get the same coverage for $15 a month, that's going to save you some additional money later on in the year after you've met that $2,000 cap. So another good reason to be paying attention to what plan you're on. Another thing to keep in mind that's come up that people have asked questions about, if you're a federal retiree or a state of Oklahoma retiree, this $2,000 cap does apply for those folks. Now, if you're on a private insurance retirement plan, you need to check with your retirement plan. You need to check with the folks at your employer's retirement plan to see if they have applied this $2,000 cap to that private retiree plan. Not all of them have to do this. So it's very important that you look into that. Now, also new this year is the Medicare Prescription Payment Plan, or the M3P program. This is also available for all Part D plans as well as Medicare Advantage plans with Part D coverage. And this allows a person to spread the costs of their co-payments and co-insurance and deductible over the course of the entire year. This is not a cost savings program. This is not like Extra Help, where it is actually reducing what a person is paying or giving them discounts or something. This simply gives them the ability to spread those costs over the course of the year. Again, looking at those individuals who are on medications who have a very high coinsurance copayment at the very beginning, that can be very crippling to a person who's on a fixed income. So this program allows them to spread that cost over the course of the year so that those people still have money to live on at the beginning of the year, and they can just pay that out over the course of the year. So the enrollment in this program is completely voluntary. You don't have to, and you can disenroll from the program if you want to. However, it's not going to change anything in terms of you can't quit in the middle of the year and think, ha, I don't have to pay that. No, there'll still be a truing up of your costs, but it is entirely voluntary. Also needs to be said, well, let's go to this next slide and I'll cover it there. So you can enroll at any point in the year. You don't have to enroll in January. A lot of people, maybe in January, you're not taking any medications that cost that much, but your doctor might wind up prescribing something to you later on in the year that suddenly is costing a lot more money. So you might be looking at enrolling later on in the year. It's important to look at whether or not the M3P program would be of value to you depending on what time of year the doctor has prescribed that medication to you. In some situations, it can help you. In others, it may not because it's too late in the year, or maybe the drug isn't really that expensive. So it's important to go through the calculation process to see whether or not it's going to help you. And there is a tool that you can use on the Plan Finder that will help you figure that out. So when you enroll in the M3P program, you continue paying your monthly premium. If you've got one, that's going to be on one invoice that you get from your plan that needs to be paid. When you enroll in the plan, in the M3P program, you don't do it through Medicare. You don't do it through Social Security. You actually contact your Part D plan or your MAPD plan to get enrolled in this program. And when you do that, let's say you go to the pharmacy, you get your prescriptions filled, you're not going to actually pay your copays or coinsurance at the pharmacy. The pharmacy is going to invoice your plan after you've enrolled, and then the plan will work through the calculations to decide how much your monthly payment is going to be for the following month. And then they're going to send you a separate invoice for that M3P payment. And we're going to have an example here in a minute so that you can kind of see how that works. Now the payments are going to change. They're not taking a set amount of money and you're going to pay 12 equal payments every month. The payments can fluctuate. Keep thinking, and I'll show you how part of that is, but also you're going to have some prescriptions that are going to get filled. You're going to have some new scripts that get written. Maybe you get sick in the middle of the year and the doctor writes an antibiotic. So some things are going to make that change. So just keep that in mind. And let's look at, okay, so we're going to take an example here. Let's say that your current medications have a total out-of-pocket costs of $500 a month. That's what you would pay in terms of copays and coinsurance. You sign up for the M3P program through your Part D plan or your MA plan in January. So you're starting out the year enrolled in the M3P plan. So you pay your monthly premium. Like I said, that's a separate invoice. You're going to do that regardless. So January, you go into the pharmacy, you pick up $500 worth of medication, but you don't pay anything there. The pharmacy is going to send that invoice to your Part D plan. The Part D plan is then going to calculate what that first payment is going to look like. And they do that by trying to calculate what that maximum possible payment would be for you as an individual. So for that first month, what they have to look at is the possible maximum amount a person would pay, since the only number they have to work with is that $2,000 maximum for 2025. So they've got the $2,000 max. You haven't paid anything. You haven't had any out-of-pocket expenses yet. So it's $2,000 divided by 12 months. That comes to $166.67. So they take that amount and they compare it to what your actual cost would have been in January, which was the $500. The lower of the two is what you actually get charged for the month of January, which would be $166.67. So your plan will send you an invoice for $166.67. That amount gets reduced or deducted from that $2,000, or from, actually it gets deducted from the $2,000, but it also gets deducted from the $500 that you would have paid had you paid the total amount. So for the next month, you've got $500 minus the $166.67 that you did pay, which leaves you with a balance for January of $333.33. Now February comes around. You have to get $500 more in medications. Again, you do not pay the pharmacy. The pharmacy sends the invoice to your Part D drug plan. That $500 gets added to the balance that remains for January, which now we have a new total of $833.33. That amount gets divided by the 11 months we have remaining in the year, which gives you a payment for February of $75.76. Now, keep in mind, the January payment is going to come to you on an invoice in February. So you're actually paying for January in February. The $75, $76 invoice for February, you get that in March. So that'll be a month behind for each one of those months. So let's go to the next month. In March, again, you pick up your $500 in medications. So you've got a remaining balance now from the previous 2 months of $757.57, plus the $500 in new medication costs, leaves you with a new balance of $1,257.57. Divided by the 10 remaining months gives you a new March payment of $125.76. So in April, you'll be getting an invoice of $125.76, still less than the $500 that you would have had to pay in those uh, earlier months. In April, this is an important month because now is when you're going to hit that $2,000 max. Since you're paying $500 a month, 500 times 4 months, that's the 2,000. So your balance was $1,131.81 for the previous 3 months, plus the $500 for April. Your new balance is $1,631.81 divided by the remaining 9 months, gives you a new monthly payment of $181.31. And you have now met the $2,000 max. You don't pay anything new for any new medications that come out. And your payments for the rest of the year will stay at around this $181, $185 amount for the rest of the year. Okay? So you can go in and you can see how this would work based on your medications. If you're not spending a whole lot of money on your prescription medications, if your co-pays and your co-insurance aren't very high, this program is really not going to help you at all. This is really specifically for only those people who are having to spend a whole lot of money at the beginning of the year. And if you know these people that are on, maybe they're surviving just on Social Security, having to pay that kind of money and rent and groceries and everything else would be very debilitating. So this program we're hoping is really going to help those people to be able to budget a little bit more effectively and to afford their costs of living throughout the year. Now, there is a really good example website here at the bottom that you can go to that can give you some additional examples of when it will benefit you to take advantage of the M3P program. So it's new. There's going to be a lot of questions about this. Probably there'll be some kinks to work out, but all in all, I'm hoping that this is really going to help some folks. There are some special enrollment period changes for 2025. Some of you may have been around way back when we had a monthly opportunity for people who were on extra help or on the Medicare savings programs that they could change on a monthly basis if they needed to change their Part D plan or uh, uh, their MA plan. They could do that on a monthly basis. Then they changed it to quarterly. A person could change their Part D plan on a quarterly basis, once per quarter in the first 3 quarters of the year, and then the last quarter of the year they could make a change during open enrollment. Now in 2025, they are going back to where you can make a change in your Part D coverage once a month if you are on extra help or you're on one of the Medicare savings programs, QuimB, SlimB, QI, and it'll be effective the first of the following month. Now, this will impact, this works for people who are on a Part D plan, wanting to switch to another Part D plan. This also will work for people who are on a Medicare Advantage plan, who are wanting to switch to a Part D plan. This does not apply for people who are on a Medicare Advantage plan wanting to switch to a different Medicare Advantage plan. It sort of excludes the Medicare Advantage plan coverage. All right. But if it's someone on an MA plan wanting to go to traditional Medicare and get a Part D plan, they can do that. Telehealth is also changing, and lots of folks got very used to using telehealth during the pandemic, and that was a time limited benefit. We've had telehealth for a long time, but you had to go to certain locations to take advantage of it. Now we're going back to where it used to be, where most of the telehealth services are only going to be available to patients in rural areas. So being able to call your doctor from home and get some of the services that you were getting, that's going to go away. You're still going to be able to get mental health services and substance abuse disorder treatment and some of the other chronic disease management services via telehealth from home, regardless of your location. But some of the other stuff that we've kind of gotten used to, I know that I took advantage of it on a frequent basis, that's going to go away. Now, CMS is reviewing it. They're looking at it because so many people did take advantage of it. And there may be some changes in that policy that come at some point in time during the year. So stay tuned. All right. These are the agencies that we are contracted with around the state. So if you've got any questions or you need some information, feel free to reach out to one of these agencies. They would be happy to help you with any questions that you may have. And what questions do we have?
So it looks like we don't have any questions at this time, but everyone is always encouraged to email MAP if there are any questions that you may think of.
I see a hand.
I do too. If you can go ahead and type your question in the chat, that way we can read it and get that answered for you.
The chat
It'd be
button's right up there at the top.
yeah, there's a chat button. So if you want to go ahead and type your questions into that chat box, I will be happy to get those answered for you. Ray, do you want to share the email address in case people are having trouble getting information into the chat?
Yes. I probably should have put that on here, shouldn't I? If somebody has any questions and we didn't get to them here, you can always send an email to map, that's MAP, at oid.ok.gov. That's map at oid.ok.gov. Or you can call it 1-800-763-2828.
And I did
So
just go ahead and share that email address in the chat for everyone,
thank
so
you.
that you can go ahead and copy and paste it. And I'm still not seeing any questions typed out in the chat, so
Let's see. You guys can, I see Yvonne, and I see Ann.
yeah, I
I've
see the
both got,
hands raised, but I'm not seeing any questions in the chat. It's possible Teams could be having some technical difficulties and might not be working, but I would encourage everyone to just go ahead and send us an email or give us a call, and we will be more than happy to get those questions answered for you all that way.
okay. Well, I'm sorry that we weren't able to get your questions answered on here, but the good news is you can always reach out to me or any of us at the Medicare Assistance Program. We would be happy to help you. Look forward to seeing you guys at the events.
Oh,
I
I see
see.
somebody. Yep, somebody just typed in. Will I be able to view this replay? Yes, so all of our Medicare Monday videos are available on demand. You can watch them anytime. If you go to MAP's website, which is that MAP what is the website URL, Ray? MAP at oid.ok.gov, I believe.
Yes.
Yep. So if you go to that website, there is a educational videos tab on the left-hand side, and you just click on that and you can see all of our Medicare Monday videos from both this year and last year as well. And I see another question we've got.
Yes.
So
So
Ray,
M3P program amount may vary from month to month depending on prescription costs. That is true. It's going to depend on all of those different things. as far as the cost and the balance, and there's always going to be that mathematical calculation that takes place. So yes, it's not gonna be consistent until you reach that $2,000 cap.
And I don't see any other questions, so it looks like we were able to get those answered. And it looks like the
Okay.
chat feature is working, which is great. We love that.
Yeah. Um,
And we will be releasing our 2025 dates and topics here in the next few weeks. So keep your eyes out for that. We will send out an email to everybody with all of that information. So if you're interested in joining us in 2025, that'll be available shortly.
all right. Uh, it says once you reach the cap, are you capped out for the year? You are, but you're still paying those payments. Uh, you still have the $2,000 cap. So if you need some more clarification on that, feel free to send an email to that map@oid.ok.gov website, or go to the website that was on the presentation there for some more examples on how that works. So, all right, we are at time. I appreciate everybody attending today and look forward to speaking to you guys next year. Have a Merry Christmas. Bye-bye.